Some people are interested and have asked question about the reversal of heart disease or have got blood pressure, cholesterol or diabetes and all, and how can we stop these blockages to be formed, or if they are formed, how can we reverse it? That's a brilliant question, and this really needs to be answered, because everyone has to work on this. Okay. So now, as I told you that we meet people at a spectrum where the blockage is 100% heart attack or 80-90% on angiogram. But when does the blockage start? They did a research where, like in the US, where 18 to 24-year-old soldiers who died, in the war, they did the post-mortem, and they found that certain blockages had already begun. Now we do the cholesterol test actually at like after 30-40 years and we go for a checkup. But in UK, they did in 18-year-old children, 18 months old infants they did. And they found that since then the cholesterol level is high. Okay, so we have to understand that we have this system. अरे बेटा खा ले बच्चा रहता है तो उसको घी खिलाओ ये खिलाओ रे, and our culture अरे तू तो छोटा है तू खा ले, हम लोग नहीं खा सकते तू खा ले, so what happens is that we are making people giving these habits, and now once they grow up and they have a problem, it's very difficult to change because already your taste buds are used to it and everything. Okay, so when we are talking of prevention, it honestly should start from home, right from the young age. That's very important. And the reason why we are having more heart attacks in the younger age groups today is all because of wrong lifestyle. So there's this famous doctor, Dr. Dean Ornish in US. He said if he says for the Indians, by the American way of living, you are learning the American way of dying. So all the fast food and all these things what we are doing, the fries and all these things is really hurting our culture and our people. So when I talk of reversing is basically, again, as I told you, that they found out that 50% of the heart attacks are caused due to faulty diets. Okay. Now, in this recent, we had this conference in US in March first week. Someone presented a research where there is a 70% increase in the risk of heart attack for people sleeping less than 5 hours. And this is a truth actually, if you see in our cities. Why these people are getting? Because most of the people are not getting adequate sleep. They reach home at 10, they eat food, then they watch TV, they sleep at 12 or 1. Next day morning again they get up and they have to go. So many times, ghar ka dabba, ghar ka khana, and they're doing things what are a common man, but we forget that sleep is the most essential factor. Not only that, inadequate sleep also actually is a cause of diabetes. People don't know this because inadequate sleep increases the insulin resistance, and insulin resistance again goes to. So that's why we are the world capital of diabetes. Diabetes is rampant among both the Indians. And why the heart disease is a major problem today in the entire world compared to the Western race, that is the white people, Indians are getting more problems. Okay. Why? Because our height and our stature, our heart arteries diameter is smaller. So the average first heart attack in an American is at 65 years. Whereas for Indians, if you see now, it is like less than 50 years, 50% people have got it. So we as a race, we have to be very more careful. I'll tell you about the cholesterol also, that 80% of the people who are getting heart attacks, cholesterol is normal. These three factors reduces by 90%. I told you in the starting, the ones who will come later on, that Cleveland Heart Clinic research says that 90% of the heart disease is preventable just by this simple measures. So what I will do is that just give you quick highlights on how can we take simple measures. So what we have done is that you all want to be happy, right? So this is a happy method, okay? So easy to remember, okay? So the happy method, what we are talking here is very simple. Heart screening regularly every year. Attitude, having the positive attitude. We'll talk a little bit about that. Plant-based diet, physical exercise and yoga. Okay, so this is the 5 easy steps which I always talk about. Very simple, easy to avoid, doesn't cost anything. Insurance doesn't cover, but you have to cover it yourself, okay? Let's come to now the conventional testing. All of you have this nowadays lab, do the cholesterol and all those blood tests which is there, and most of the times, oh, aapko kuch nahi hai, family doctor kuch nahi hai. Most of the times, even if you see the people who have got heart attacks, they have done their screening and every time the reports have been normal. Stress test 2D echo, 50% of the people they have normal. Okay, your 2D echo will go bad only after heart attack. Before that, even if you have blockages, it will not show. Cardiogram, blockages, it will not show. Okay, so what we are doing is here, we are doing something very different. Like, I don't know whether you have seen the movie, it's very popular, Finding Nemo. So I said, let's have this finding your heart blockage, you know. It's like a detective work, okay. So what we are doing here is, apart from the cholesterol and all things, let me give you a simple analogy. If there is a bank robbery, you know, have you seen typically, sab chor bhag jate, aakhri wala bhag raha hai, and then the police enters and catches that guy, you know. So cholesterol is that last robber. 6 जन भाग गए और पता नहीं कौन है. So this is what, when we are doing the blood test here, so basically oxidative stress, inflammation, there are a lot of other factors, okay, which are actually causing the blockages, but they are never studied. As I told you that what we are offering is that we are offering the cardiac rejuvenation therapy, which is basically, I spoke to you about ECP with lifestyle changes. So we have a complete diet, exercise, yoga, everything. And as I told you that is pretty much great as an alternate to surgery with what we have done. Then we are offering diabetes reversal therapy. So the people who are having diabetes, if they want to reduce their medication and reverse the diabetes process, we help them with frequency therapy, breath work, natural supplements, you know, so we help them on with our diets and all. Next, hypertension reversal, because see, if you look, the routinely when you go to a doctor, you know, like, okay, I know that you go, ek dawai likha, they'll come after 6 months, but how are you increasing your blood pressure? What are you doing in the whole day which is increasing the blood pressure? Or how are you increasing the diabetes? Nobody studies that. So that is what we do here. We go to your entire history and how this blood pressure and what are the causes. We go to the root cause. Okay, so that is what we do. Then we also work on the losing of the weight and high cholesterol, family history anybody has got. So they are at high risk for having a heart problem. So we guide them on how not to get a heart problem. So these are our preventive and curative programs. So second thing is that they have said that whenever we have chronic stress, most of the times when we have seen people get heart attack, they are always into acute stress. It increases, acute or chronic stress increases by almost 400%. The chance of getting a heart attack and heart disease and all. Then of course we have our dietitians and we talk of plant-based diet. Remember one thing, that plant-based diet is the only diet in the entire world which has been research proven to prevent heart disease and reverse heart disease. Okay. So there is a lot of importance on plant-based. So a lot of people in US ask me that, oh, Indians are vegetarians, why are we getting so much heart disease? But we are vegetarians, but we don't eat vegetables, we eat atta. We eat, so because we eat so much of this chapati, rice and all this fried foods and all those things. So which is included in vegetarian. That's why I said plant-based diet. So that's why we talk of plant-based diet. And another P of happy is the exercise. For the American Heart Association, we have to do 10,000 steps, which is almost like 4 miles, it comes to, okay? But nobody has got that kind of time and all. So, but at least if you can walk 1 mile also for prevention, which is good. And people who have got heart problems, 3 to 4 kilometers every day, or minimum at least 3 times a week, that is something which is there. So physical activity in any form, if you don't like walking, then swimming or anything which is good for your cardio, which is very, very beneficial. Last, the Y is for yoga. So why we are talking of yoga? Because yoga is a science of the body, mind and the soul.